also do the auditing as well. For example, the documentation, everything has to be regulated, every monthly audited, and then ensure it's not happening again. That's my perspective of the risk management. Thank you.
Thank you very much. Dr. Mark Gurdon, please.
Hello. Okay, so thank you very much, and thank you to the WFC for the invitation. I think this morning's session has been fantastic, and we've already heard some fantastic points about patient safety and about risk management, and I think some of this may come through in my talk this morning as well. So the first thing I would like to say is I think as a profession we need to actually own risk and risk management. We don't need to be dictated to by other professions, and there's been a history of that in the past. So it's incumbent on all of us to take this area seriously. Clinical risk management is a crucial aspect of modern healthcare, and it encompasses identification, assessment and mitigation of risks to both patient safety but also patient well-being. And I think that's an area that sometimes gets missed. And it was mentioned this morning actually by Dr. Pullman, things like misdiagnosis, patient exposures to inappropriate advice and suboptimal outcomes from inappropriate care. So chiropractors, like all healthcare professionals, must develop a clinical risk management strategy to help them provide the best possible care for their patients. Now, adopting a culture of safety involves teamwork, openness, honesty, candour, particularly in reporting safety incidents, as has been mentioned already. In the United Kingdom, the Royal College of Chiropractors has got some 14 years experience of this, in that we administer a chiropractic patient incident reporting and learning system that's available to our members. It's an anonymous system, and the key emphasis is on learning from that. And from that, we issue patient safety notices. But the Royal College also plays a significant role in promoting other objectives by publishing quality standards, evidence-based practice guidelines, and providing appropriate CPD. And to give you an idea, the last 2 years out of directed CPD in the UK, it's been on communication, which nearly is all, it's been mentioned consistently throughout this meeting as an area of concern, and on consent, taking appropriate consent. So I think that's the area that is very important to us. So I just want to give you 7 points very briefly on what you may want to consider if you're putting a strategy together. Some of this, as I say, has already been mentioned. So education and CPD, I think, is a really important area. Chiropractors should focus their CPD on gaining an understanding of clinical risks and contraindications for their care, and also I think it's important that we support the research in those areas as well. We should use, wherever possible, evidence-based guidelines and standards. I'm going to give a plug to the Royal College because we've got a number of these, and if you're interested, come and have a look on a poster, and you can download these through a QR code. But I think that's another way of making sure you're not straying too far away from the norm. Communication, and we have a standard on communication. We should maintain open, honest and clear communication with patients, explaining treatment options, but also looking at treatment plans and risks, as has already been said. Record keeping, again, a key area. Chiropractors must maintain thorough, accurate clinical records, and again, plug for us, the Royal College, we've got a standard on that as well. I think collaborative working is also important. I think working in isolation and working in silos is a dangerous place to be when it comes to patient safety. So things like peer review, and if you have the luxury of multidisciplinary teams, that's fantastic. Incident reporting, as I've already mentioned, I think we should all look to try and learn from mistakes. Mistakes happen to every healthcare professional, and we need to improve. And I think participation in a national scheme, or dare I say even an international scheme, would be fantastic. So I would encourage countries that don't have incident reporting systems to look at those. And then finally, the seventh point, having good clinical governance in place. And by that, I mean some of the things I've already mentioned, but also protocols in place to address areas like audit, safety, policy, development, monitoring patient experience, monitoring outcomes, information governance, and leadership. So I think that's a fairly brief run-through of a strategic approach, but I think it's a good starting point, and be happy to discuss any of those areas with you afterwards. So thank you very much.